You know, deep inside your chest, your heart is beating away day in and day out. But here's something you probably don't think about. It's not working alone. It has this silent, invisible guardian, a bodyguard, really. But what happens when that bodyguard goes rogue?
Right, so let's get into it. We're going to open the case files on the pericardium. We'll look at what happens when it gets overfilled, what happens when it's just missing, and what all that means for the one organ it's supposed to be protecting.
Okay, first things first. Before we get into all the ways things can go wrong, we need to meet the main character here, the pericardium, when it's just doing its job perfectly.
So, picture this. The pericardium is this tough, two-layered bag. You've got one layer that's basically shrink-wrapped right onto the heart. That's the visceral layer. And then there's an outer layer, the parietal. In between those two, there's a little bit of fluid, and it acts like the perfect lubricant, letting the heart beat millions and millions of times in an almost frictionless world. It's the ultimate security system.
And the amount of that fluid is absolutely critical. In a healthy person, you're looking at about 50 cubic centimeters. That's not much, just a bit more than a shot glass. Now remember that number, because the minute it starts to change, that's when the trouble starts.
All right, let's open our first case file. This is what happens when that perfectly balanced system gets totally overwhelmed, and that sac starts filling up with way too much fluid.
The official name for this is a pericardial effusion. It's a fancy way of saying the fluid has gone way past that 50 cc limit. Now, this can happen for a whole bunch of reasons, infections, injuries, inflammation, but there are a few classic suspects that doctors are always keeping an eye out for.
Yeah, so 3 of the usual suspects are renal failure, an autoimmune disease called lupus, which often presents with this classic butterfly-shaped rash on the face, and something called Dressler syndrome, which is this inflammatory reaction that can pop up after someone's had a heart attack. These are major red flags. So how can you actually see this? Well, on an X-ray, there are 3 classic giveaways. First, you pull up an old X-ray and compare it to a new one. If the heart shadow has suddenly gotten huge, that's a big clue. Second, the shape itself starts to change. It sags and looks like an old-school water bottle or flask. And my absolute favorite is the Oreo cookie sign. On a side view, you can see 2 dark lines of fat with a bright white line of fluid sandwiched right in between them. Looks just like an Oreo cookie.
Now, an effusion is definitely serious, but believe me, it can get a lot worse. This is where we escalate to a true life or death situation, where the bodyguard isn't just full, it's actively squeezing the heart. This is a condition called tamponade.
With tamponade, the pressure inside that fluid-filled sac gets so high that the heart literally can't expand to fill up with blood anymore. The atria, which are the smaller chambers on top, get squished first. Then it starts compressing the big, powerful ventricles at the bottom. And get this, it can happen with as little as 100 cc's of fluid, which is only double the normal amount.
And here's the most critical thing to understand. It's not always about how much fluid there is. It's about how fast it gets there. If the fluid builds up really slowly, say over weeks or even months, the pericardial sac is stretchy. It has time to adapt, and it can sometimes hold a huge amount of fluid. But if that same amount of fluid shows up in just a few minutes, maybe from a traumatic injury, the sac can't stretch, pressure goes through the roof, and suddenly you've got a massive emergency on your hands.
So what's the smoking gun on an imaging scan? It's this. The septum is that muscular wall that separates the heart's 2 main pumps. When the pressure outside the heart gets to a critical point, it starts pushing that wall inward, making it flat or even bowing it in the wrong direction. That's the definitive sign that the heart is in a dangerous squeeze.
Okay, let's take a step back from the ER for a minute and look at something way calmer, but also pretty weird, the pericardial cyst. This one isn't a threat, it's more of a medical curiosity.
The number one thing to know about this is that it's completely, totally harmless. Seriously. It's almost always found by pure accident when someone gets a CT scan of their chest for a completely different reason. Doctors call this an incidental finding.
So what is it exactly? Well, it's a little mass that's filled with fluid, so it has water density, and it tends to show up in a very specific spot, the right cardiophrenic sulcus. That's just a little corner where the right side of the heart rests on the diaphragm. But here's the most important detail. It doesn't actually connect to the pericardial sac. It's like a quiet little neighbor that just happens to live next door.
And now, for our final, and I think strangest case file. What happens when the bodyguard just isn't there? What if you're born without a pericardium at all? So what's really interesting is that it's actually pretty rare to be missing the whole thing. What's much more common is a partial absence, and it's usually missing over the left side of the heart. It's like the bodyguard has a big hole in its coverage on one side.
So what does this do? Well, without that sac to hold it in the middle of the chest, the heart does something pretty dramatic. It just shifts way over to the left. It often ends up resting right up against the inside of the left chest wall. When a radiologist sees that on a CT scan, it's a dead giveaway for the diagnosis.
And if you thought that was weird, check this out. Normally, the pericardium creates a wall between the body's two great vessels, the aorta and the pulmonary artery. When that wall is missing, a little piece of the lung can actually sneak right into that space. It creates this bizarre-looking formation that doctors actually call it tongue of lung. It's an unmistakable sign.
Now, a lot of people can live their whole lives with this and have no problems at all. But there are some rare and pretty serious risks. For example, if a patient with this condition has surgery to remove part of a lung, the heart can actually slip through that opening. That's a herniation, and it can even twist on itself. The part of the heart that's most at risk of getting pinched or strangled in that hole is a little pouch called the left atrial appendage.
So there you have it. From a life-threatening pressure cooker to a harmless little cyst to just being gone altogether, the heart's bodyguard has a really complex and fascinating story. It kind of makes you wonder, doesn't it? What other secrets is the human body hiding from us, right